The dorsal interossei originate on the metatarsal shafts of each digit. The first dorsal interossei inserts at the base of the second proximal phalanx medially in the dorsal digital expansion. The second dorsal interossei inserts at the base of the second proximal phalanx laterally in the dorsal digital expansion. The third dorsal interossei inserts at the base of the third proximal phalanx laterally in the dorsal digital expansion. And the fourth inserts at the base of the fourth proximal phalanx laterally in the dorsal digital expansion. They are innervated by the lateral plantar nerve S1, 2, and 3. Supply provided by the branches of the plantar artery. Its action is to abduct, abduct the toes, and you can remember this by the acronym DAB, D for dorsal, abduction for its action. The plantar interossei originate on the third through fifth metatarsal bases and shafts medially. So digits 1, 2, 3, medially, medially, medially. And they insert on the proximal phalanges of the same digits along the medial side. Proximal phalanx, proximal phalanx, proximal phalanx. They have the same innervation, lateral plantar nerve, S1, 2, and 3. Blood supply provided by the branches of the plantar artery. And their actions are to adduct. So you can remember this by the acronym PAD. P for plantar, adduction for adduction of digits 3 through 5 in the foot. The flexor Hallucis brevis has two heads. The lateral head inserts on the cuboid and the lateral cuneiform. Cuboid, lateral cuneiform. The medial head originates from the tendon of the tibialis posterior and the medial intermuscular septum. To refresh your memory of the tibialis posterior insertions is the sustentaculum tali, the medial and intermediate cuneiforms, and the navicular are all the tibialis posterior insertion points, which serve as the origin points for the medial head of the flexor Hallucis brevis. The flexor Hallucis brevis inserts on the proximal phalanx of the hallux at its base and the sesamoid bones. It is innervated by the medial plantar nerve, L5, S1, and 2. Blood supply provided by the branches of the plantar artery. And the action of the flexor Hallucis brevis is to flex the first MTP of the hallux. The Abductor Calluses has two heads, the oblique head and the transverse head of origin. The oblique head originates at the bases of the second through fourth metatarsal, and the transverse head is at the metatarsal phalangeal joint of digits 3 through 5. These two heads originate on the lateral side of the proximal phalanx of the hallux and the lateral sesamoid bone. It is innervated by lateral plantar nerve S1 through 3 and blood supply provided by the branches of the plantar artery. The Abductor Calluses, as its name describes, has the action of adducting, adduction of the great toe. The flexor Digiti Minimi brevis originates on the medial plantar surface of the fifth metatarsal base. It inserts on the proximal phalanx of the fifth digit on the lateral side. It is innervated by the lateral plantar nerve, S1 through 3. Blood supply branches of the plantar artery, and its action is to flex the fifth MTP. The Quadratus Plantae, also known as the Flexor, Digitorum, Accessorius, has 2 points of origin, a medial head and a lateral head. The medial head is on the calcaneus, medial concave surface just below the groove for the flexor hallucis longus, and the lateral head on the calcaneus as well, that is distal to the lateral process of its tuberosity and to the long plantar ligament. Both of these insert on the lateral side of the flexor digitorum longus tendon. The Quadratus Plantae is innervated by the lateral plantar nerve, S1 through 3. Blood supply are the branches of the plantar artery. Its action is to correct the diagonal pull of the flexor digitorum longus tendon. The lumbrical muscles originate on the flexor digitorum longus tendon on the medial sides of the tendon, and they insert on the dorsal digital expansion of the 4 lesser toes medially. First lumbrical is innervated by the medial plantar nerve L5, S1, and 2. Innervation for the 2nd through 4th lumbricals are by the lateral plantar nerve S1 through 3. The blood supply are branches of the plantar artery, and the action of the lumbricals is to flex the metatarsal phalangeal joints and to extend the IP joints of the lesser 4 digits. The Abductor Calluses originates on the flexor retinaculum in the calcaneal tuberosity on the medial side. It inserts on the medial side of the proximal phalanx of the hallux. It is innervated by the medial plantar nerve L5, S1 through 2. Blood supply branches of the plantar artery, and its action is to abduct, abduct the hallux. The flexor digitorum brevis originates on the calcaneal tuberosity on the medial process and central plantar aponeuros. It inserts on the sides of the bases of the middle phalanges of the lesser 4 digits. It is innervated by the medial plantar nerve L5, S1, and 2. Blood supply provided by the branches of the plantar artery, and it flexes the PIPs of the 4 lesser digits. The abductor Digiti Minimi originates on the calcaneal tuberosity along both the medial and lateral processes in the plantar aponeuroses. It inserts on the proximal phalanx of the 5th digit at its base. It's innervated by the lateral plantar nerve, S1 through 3. Blood supply branches of the plantar artery, and its action is to abduct the 5th digit, or your pinky toe. The extensor digitorum brevis is on the dorsal side of the foot. It originates on the calcaneus on the dorsal surface and inserts on the 2nd through 4th toes at the dorsal aponeurosis and the bases of the middle phalanges. The extensor digitorum brevis is innervated by the deep peroneal nerve L5, S1, and 2. Blood supply are the branches of the anterior tibial artery, and its action is to extend the digits 2 through 4, which is also dorsiflexion. Another muscle that is sometimes grouped with extensor digitorum brevis and sometimes isolated is the extensor hallucis brevis. It has the same origin on the calcaneus, but it inserts onto the first toe at the dorsal aponeurosis and proximal phalanx. Has the same innervation of the deep peroneal nerve, L5, S1, S2. Blood supply of branches of the anterior tibial artery, and its job is to extend the first toe at the MTP joint.